Hey YouTube, welcome back to my channel. I'm Tony. I'm an adult gerontology primary care nurse practitioner, and I come to you today regarding how I got into home health nursing as a registered nurse by request from one of our viewers. So let's get this started, okay? Just a brief summation of how I led up to nursing. I graduated high school, I went to Penn State, I graduated with my Bachelor of Science in Biotechnology. I hated it, worked that for a few years before I finally decided to go back for my Associate in Applied Science in Nursing, associate's degree. Okay, I worked in nursing. I worked a few things before I found my niche. I would not recommend how I went about doing things because I got to a point where I was almost blackballed, I guess. I shot myself in my foot myself. I had about 5 positions in the first 2 years of my nursing career. And it's because I just, I'm, trying to find yourself or whatever they call it. But I wanted to make sure I liked my job. I didn't want to stay in something that I'd be miserable in. So anyway, fast forward 2 years into my nursing career, I found, actually not even 2 years, probably less than 2 years, I found my niche in home health nursing. So I got into it the latter part of 2006. I graduated nursing school 2005. And I still kind of hopped around a little bit shortly after finding my niche, but I knew that's what I wanted to do. So anyway, I finally got steady in home health, a steady job. Stayed longer and longer in subsequent positions. And my last positions, or a couple positions, I moved around within one company, was from 2009 to 2013. And it's during my tenure with that company is where I decided to really delve into home health documentation. Home health nursing, as it is it's a very autonomous position. It is highly recommended that you already have nursing experience before you get into home health nursing, but it's not completely, illogical that brand new nurses get into home health nursing. But some states do mandate that you have experience before going into nursing. Before going into home health nursing. So with that being said, I had about a year and change experience before I got into home health nursing in 2006. And like I said, I was a field nurse, and then I moved into the office, into like a assistant to the director of nursing. Then I moved up and became a director of nursing. And then I moved on to what my previous company called it, clinical ops consultant, where they had several of us within the company, and we had different territories of different agencies, and we would go in and audit them and make sure home health documentation is on point. They're not trying to cheat the government. They're not trying to overcode, undercode, make sure their documentation says what they want to say, make sure if they document something going on with the patient, that it was recorded, that it was reported to the physician or the provider. And if it wasn't, then we, educate the clinicians and make sure there's some kind of action plan in place. We basically acted as mock surveyors. I know those in the hospital are used to JCO, or Joint Commission. They changed their name. We'll visit hospitals and make sure, everyone's on their P's and Q's. Well, in home health, we have state surveyors that come in from the state. They represent Medicare, and they come in and make sure home health agencies are doing what they're supposed to do. They look through the charts. They make sure, we're dotting our I's, we're crossing our T's. So my position at that time was to basically be that person within the company. And we did this regularly. So it got to a point where the goals of the company were changing, and it wasn't in line with my goals. So in the last few years of working for that company, I acquired my OASIS documentation, which is, the OASIS is the document that needs to be completed in home health, is required by Medicare, CMS, Centers for Medicare and Medicaid Services. And so there's a bunch bunch of data items on that form, and the clinician's assessment should align with the responses to these items. And so I got certified in the knowledge and the interpretation of that document. I also acquired my coding certification, At the time it was ICD-9, and then when it changed to ICD-10, I took the exam again and made sure I maintained my coding certification. So once I acquired those certifications, I left my company and I decided to work independently for different agencies that will work with home health agencies, checking on their charts, checking to make sure their documentation is on point. So basically the same thing I was doing for my previous employer, I'm doing now as an independent contractor. And I've been doing that since 2013. So one of our viewers, I don't know if they're a subscriber, but I hope they're subscribed, asked how did I get into this? That's basically how I took the initiative. My company did not pay for my certifications. Every year around my birthday in June, I would choose a certification to get. So it started in 2010. June 2010, I started with my wound care certification. 2011, I didn't get any certification. I actually took a vacation for the first time in a very long time. June 2012, I acquired my OASIS certification. In June 2013, I acquired my coding certification. And then I left later that year. I left the company later that year. So with that knowledge, I've been coding and doing OASIS for way before, I got with that employer that I stayed with for nearly 5 years. But I just decided to get the certifications at that time. And so once I had these certifications in my pockets, if you will, I decided to branch out. And you're more marketable with the certifications. You can have all the knowledge in the world, but a lot of these companies require that you have OASIS and coding certification, home health coding certification, because there's a lot of different types of coding certification. So for me, I am ICD-10 coding certified for home health, which the ICD-10 codes don't really change from home health to outpatient to inpatient. It's just the rules of what to code and when to code changes from setting to setting, but the actual codes themselves, they don't change. And the certain rules actually don't change as well as in terms of how to code, but that's a completely different topic and we're not going to get into that today. Okay, so to answer the question of how I got into documentation, get a love, get used to the OASIS, get used to coding, and get your certification, and then you too can have an at-home job doing home health chart coding and just reviewing charts from home as a registered nurse. Okay, I hope that answers your question. Whoever you are out there, what was their name? XM is how I have you down. So I hope this answered your question. I hope you tune into this video. And for anyone else who is interested in home health nursing, I hope this answered a few questions. If anyone out there would like to learn more, know more, hit me up in the comment section, leave a comment. Maybe I'll make a video delving into it more. But that was before my NP days, so I'm trying to shy away from it now, but I'm happy to answer any questions from whatever knowledge I have retained since graduating NP school and trying to move away from it. But yes, I hope you enjoyed this video. Give us a thumbs up if you like it. If you don't, then you could give it a thumbs down, but we don't like thumbs downs. And if you think it was helpful, you think someone else might benefit, share it. Share it with someone you love. Share it with someone you hate. And if you think you like my channel, you think you like the videos, you think they're informative, you think I'm crazy, subscribe today. Come back for more. All right. That's all I got for you. All right. Take care. Mask up. Keep your distance. Wash your hands. Stay safe. Stay healthy. All right. Talk to you soon.